Today, we're speaking with Mark Brooke, who's the CEO of the Lung Foundation. And Mark, we were just having a bit of a chat before we started, and I think that there's a super interesting conversation to be had around chronic respiratory illness and around, aging, and even, you were talking about the fact that some of the symptoms are actually dismissed as aging, and I think that's really interesting, particularly when the Starts at 60 audience is a little bit older. Could you maybe tell us a little bit more about that in terms of, what the work that the Lung Foundation is doing and how that relates to the conversation that we're going to have today about this COPD checklist?
Yeah. Thank you. It's a delight to be able to talk and explain to your readers what lung health looks like in the 21st century. We're increasingly we're focusing in on airways disease across the life course, because what we know now, and it's been really fascinating to come back from a European conference which is repositioning chronic airways disease. We've looked at chronic airways disease largely through the lens of smoking, and rather than reflecting just on smoking as being a cause of chronic airways disease, what we understand and what the evidence is evolving to is that chronic airways disease that you see later on in life actually began to germinate in those first few years of life. And that as you accumulate the years of your life, what we're beginning to understand is there's a whole lot of factors, whether it's the quality of the air that you breathe, whether it's the occupation that you have, whether it's the type of housing that you live in, your choice of hobby. Did you do pottery? Did you look after birds? All of those things accumulate over a life's course that may end up resulting in an airways disease later on in your life. In this case, chronic obstructive pulmonary disease. So we know that chronic obstructive pulmonary disease is an umbrella term for a whole range of conditions. People might be familiar with the term emphysema, for example, or chronic bronchitis or severe asthma. But what we now know is that people are beginning to show signs of airways disease at a much younger age. And I think the really fascinating thing, because we've just completed a very large lived experience survey, which covers the breadth of Australia of people of all ages, but particularly people who are over 60, we're starting to say things like, "Oh, I'm beginning to be more breathless. I can't play with my grandkids as often as I would like. I get fatigued really easily." And they've put that down to just aging. In fact, a lot of that has to do with a particular airways disease. So it's really important that people understand the symptoms of airways disease and that they accumulate over the life course, that there's a whole lot of variables that start and push and pull at your airways. But this notion of it's normal to be tired or breathless or fatigued is one that we're really clear to sort of demystify and debunk.
So I think we probably covered then what is it, and I think that's really interesting for me because I didn't really think of COPD, as you say, chronic obstructive pulmonary disease. Read it so I get it right, as covering such a sort of broad range. So, but maybe you could tell us how common is COPD?
COPD is one of the most common chronic conditions in Australia and indeed globally. And we know that about 1 in 3 Australians will have some form of airways disease across their life course. But for COPD, it is the leading cause of avoidable hospital presentations in Australia. So when you see the daily news and you think about, oh, there's hospital ramping and people can't get beds, it's chronic obstructive pulmonary disease, infections of the lungs, which are the major contributor to avoidable hospital stays here in Australia. And in many of Western OECD countries, it's the same story. So you usually have little kids with viral infections needing to go to hospital. You also have older Australians with viral infections and COPD who take a little bit longer to be able to bounce back to good health. So COPD is the umbrella term for emphysema and chronic bronchitis and chronic asthma. But in really simple, non-medical terms, it's just the narrowing of your airways that makes it difficult to breathe. So you get breathless.
Now, it sounds to me like it's definitely environmental, but is it also genetic? So I guess what are the common causes, and is it a mix of genetic and environmental, or what causes COPD?
Look, the major contributing factor is if you currently smoke, or you have smoked in the past, or you've been exposed to smoking. So, in generations gone by, in my own household, we grew up with smoking indoors. I think one of those really fascinating facts that people forget about is it's only been about 25 to 30 years ago that we stopped smoking indoors in workplaces, on aeroplanes.
Aeroplanes, exactly.
In pubs. So it's all of those places. So across your life course, you've been exposed to a whole range of things. We now know that the quality of air that we breathe directly contributes towards COPD and lung cancer. That's absolutely one of those things that is proven well in science. But depending upon your occupation and where you worked, if you worked in heavy industries or you worked in mining or construction or agriculture, you'll have been exposed to additional contaminants which may have got into your lungs and contributed towards COPD. There is some evidence of genetic and family history, but often, if you think about your lungs as giant sponges that sort of suck up everything that you breathe, they're there to protect the rest of your body. They filter everything out. Of course, for people listening to start at 60, they'll have got 60 plus years of accumulating everything that's coming into your lungs. The really important thing for the Lung Foundation is that we don't blame people that were addicted to smoking. We just don't. We understand that it was a community-wide, societal accepted habit, not a healthy one, that most people, as many as 70% of Australians smoked through the 60s, 50s, 60s and 70s, and they'll be the people listening. We don't blame you for that. The results of having a COPD diagnosis are the results of a decision you might have made when it was a societal norm. The most important thing we do now is understand that the earlier we can detect COPD, the more opportunities we have to put in place measures that can protect your lungs.
I loved that visual that you just gave around the lungs being almost like a filter for the body, having worked so hard to filter out all of those toxins. And it's such a great way to think about your lungs and lung health. And to be honest, when we sort of just carry out our normal day breathing, it's you're not always conscious of the fact of how hard they're working for you. It's quite a fascinating way to as something that I don't think of all the time. It is such a fascinating way to think of them as a filter.
If I took your lungs out and we laid them out, it would cover a tennis court. So that's how big your lungs are. When you think about all the layers of your lungs, we would cover an entire tennis court. Australians really have only experienced poor lung health a couple of times. So during the pandemic, people were really, really sensitive to their lungs. But we forgot about 2019 and 2020 when much of Australia was consumed by bushfire smoke, and people with general good, healthy lungs experienced for the first time what it was like to be breathless, because we were breathing in so many contaminants. So Sydney and Melbourne and Adelaide and Brisbane and other capital cities that had multiple days of poor air quality.
Yeah.
Your average person in the street began to understand what that was like. Many patients describe it as sort of trying to breathe through a straw. So that's not normal. So having this cough or having this breathlessness or fatigue is not normal for lung health. But the message that we're trying to put out is that the earlier you can diagnose COPD in particular, the much better it is.
And, I think that's you're talking to a lot of grandparents too when you're talking to the Starts at 60 audience. And I think that is a really interesting takeout for me in terms of how they can, also share the message with their grandkids. But so how would someone know if they have COPD, Mark?
Sure. So it's a really important conversation to have with your regular healthcare provider, so your general practitioner. Most of the listeners, at Start at 60, will have a good general practitioner, we hope. If you're an Aboriginal and Torres Strait Islander person, you'll have a great Aboriginal and Torres Strait Islander health liaison officer or a health practitioner or professional. But having a conversation with your general practitioner about the symptoms is really important. So if you're beginning to feel breathless, that's not a normal function of aging. You're beginning to cough a lot, and that cough doesn't go away after 4 weeks. They're generally signs that something is going on with your lungs. If you're prone to repeat infections, so viral infections, the flu, and it takes you much longer to bounce back, that's because your lungs are you might be compromised. Your lungs are taking a lot longer to get back to your normal range. The gold standard is a thing called spirometry, which is basically you blow into a tube and you blow for as long as you possibly can. You do that a couple of times, and we measure what your air function is, your FEV. You might hear that term. That just tells us how good your lungs are working. And if we can understand how good your lungs are working, then we're able to see if there's any deterioration. But being short of breath, having excessive phlegm, all of those things are pretty clear indications that something's not working in your lungs.
So, Mark, how can people manage their COPD? I know you've got this fabulous checklist that I'd love you to tell everyone about as well. So maybe you could tell us a little bit about that.
Yeah, look, it's really important. I think first and foremost, we encourage everyone, as hard as it is, to quit smoking, and persevere. We're talking to people at Start at 60 who are resilient and intelligent. They've got a lifetime of experience. We know at the Lung Foundation how hard it is to give up smoking, but persevere. Your family, your loved ones, your friends will all appreciate it. That's the first thing. We're not here to lecture you about that. But it's really important that when you have a conversation with your usual care provider, whether it's a general practitioner, that you have a COPD action plan, that you know what your medications are and how to use those medications correctly. I'm so surprised at how many healthcare professionals don't know how to use a whole lot of medications. So make sure you can go to our website, have a look at the website, see how to use those medications properly. Because they can be expensive and you don't want them just floating around in the air. So getting to use your medications so they get deep down in your lungs, absolutely important. Having a fairly healthy lifestyle in terms of knowing what you can do physically. Now, that might be going for short walks to the shop. It might be going to a pulmonary rehab or a lungs in action program. All of those things are really important. But going and doing the COPD checklist that gives you really simple, actionable advice is absolutely critical. The best thing that we can do for COPD is teach people how to self-manage the disease. There's a wonderful ambassador for the Lung Foundation, Russell, who is called the COPD athlete. He's running a marathon with oxygen this week in Berlin. Now he has, I think, 40% lung function. So, now that's not going to be possible for everyone that's listening, but there are really simple, everyday things that we can do to really maximize your well-being. And that includes both your physical and your emotional well-being. A lot of patients tell us that they feel isolated, they feel alone, they feel really scared about COPD and what it means. Build your tribe. find mates, find friends that can lift you up, that can walk with you, that can help you with the shopping, that can help you hang out the washing. Do those types of things. If you look after your mind and your lungs in unison, you get a really, really much improved outcome.
Fantastic. Mark, it's been an absolute pleasure talking to you today. Thank you so much.
My pleasure. It's a topic we're very passionate about. 650,000 Australians will have COPD. The earlier we get to see you, the more support we can give you, the better you will be.
Thank you so much.